So we are discussing different areas of the heart: aortic area, pulmonary area, tricuspid area, and mitral area. To diagnose a question of murmurs in the Plab 1 exam, the first step is to remember these areas. So aortic area is located in the second intercostal space on the right sternal border. Here is the second intercostal space, and this is the right sternal border. This is aortic area. And in the second intercostal space, on the left sternal border, there is pulmonic area. So two areas are located in the second intercostal space. One is aortic area and the other one is pulmonary area. Aortic area is on the right sternal border and pulmonary area is on the left sternal border. Now, tricuspid area is located in the fourth intercostal space on the left sternal border. And the mitral area or the apex of the heart is located in the fifth intercostal space in the mid-clavicular line. So this is clavicle, and if we draw a line from the mid-clavicle, then it will meet in the fifth intercostal space at the mitral area or apex of the heart. So two areas are located in the second intercostal space. One is in the fourth intercostal space and one is in the fifth intercostal space. In second intercostal space, on the right side is aortic area, on the left side is pulmonary area. In the fourth intercostal space, on the left sternal border is tricuspid area, and in the fifth intercostal space in the midclavicular line is mitral area or apex of the heart. So in aortic area, the murmur of aortic stenosis and aortic regurgitation will be heard. In pulmonary area, pulmonary stenosis and pulmonary regurgitation will be heard. In tricuspid area, tricuspid regurgitation and tricuspid stenosis will be heard. And in mitral area or at the apex of the heart or in the fifth intercostal space in the midclavicular line, mitral stenosis and mitral regurgitation murmur will be heard. So this was a brief description of areas of auscultation of the heart. Now remember that to identify or diagnose correctly the type of murmur, you should know which valves are closed during systole and which are open. Similarly, you should know that which valves are closed and open during diastole. So can any one of you tell me which valve are open during systole? Can anyone tell me which valves are open during systole?
Pulmonary and aortic.
Yes, pulmonary valve and aortic valve are open during systole. So if pulmonary and aortic valve fail to open properly, if pulmonary or aortic valve fail to open properly, then we will call it as aortic stenosis or pulmonary stenosis. So stenosis basically mean in one line or two-word answer for stenosis is failure to open properly. So the murmur of pulmonary stenosis and aortic stenosis will be heard in systole. So if there is ejection systolic murmur, in the second intercostal space on the right sternal border, an ejection systolic murmur means a murmur during systole is of aortic stenosis, because during systole the aortic wall should be open, but if they fail to open properly, a murmur of stenosis will be heard. Similarly, can anyone tell me which valves should be closed during systole?
Sir, can you repeat the valves which opened during systole?
The valves that are open during systole is, you know, that during systole, the heart has to pump blood in the systemic circulation through aorta and in the pulmonary circulation through pulmonary artery. So aortic valve and pulmonary valve should be open during systole. And if they fail to open properly, it will lead to a murmur of stenosis. So pulmonary stenosis and aortic stenosis murmur will be heard during systole. Now, can anyone tell me which valve should be closed during systole?
Tricuspid and mitral.
Tricuspid and mitral valve should be closed during systole, and if they fail to close properly, then it will lead to murmur of regurgitation. So normally during systole, mitral valve and tricuspid valve should be closed. So if they fail to close properly, if a valve fail to open properly, then it will lead to a murmur of regurgitation. If a valve fail to close properly, then it means there will be backflow of blood or regurgitation. So in simple words, failure to open properly, stenosis; failure to close properly, regurgitation. So four murmurs can be heard during systole. What are those four murmurs? Two stenotic murmur and two regurgitant murmurs. If you know that which valves are closed during systole and which are open, then you can tell which murmur will be heard during systole. Four murmurs will be heard during systole: two stenotic murmur and two regurgitant murmur. Stenosis murmur of the valves which should normally be open, such as aortic and pulmonary valve. So aortic and pulmonary stenosis murmur will be heard during systole, and regurgitant murmur of those valves which should be closed, like mitral valve and tricuspid valve. So mitral regurgitation and tricuspid regurgitation will cause a murmur during systole. So as everyone clear about the murmurs during systole, which are the four murmurs which can be heard during systole? Is it clear, everyone? Any questions so far? Dr. Sambal, do you want to ask anything? Dr. Joe?
No, sir.
No, it's clear, sir. Thank you.
Now, if you know the area and if you know the valve that should be closed and open during systole and diastole, then you will be able to correctly identify the murmur. So, if in the question they ask that there is an ejection systolic murmur in the second intercostal space on the right sternal border. So in second intercostal space on the right sternal border is aortic area. And the murmur is heard during systole, or the murmur is ejection systolic murmur. Now in the aortic area, two murmurs can be heard. One is aortic regurgitation and one is aortic stenosis. So aortic regurgitation or regurgitation murmur means the valves fail to close properly. So when should the aortic valve should be closed? Normally, when should the aortic valve be closed?
During diastole.
During diastole.
Lastly.
So the aortic regurgitation murmur will be heard during diastole. And aortic stenosis murmur will be heard. Stenosis means the valve failed to open properly. So normally it should be open during systole. So the murmur of aortic stenosis will be heard during systole, or there will be an ejection systolic murmur. Now, uh, can anyone tell me from these two basic principles that uh, when a murmur of mitral stenosis will be heard? When a murmur of mitral stenosis will be heard? Stenosis means the valve failed to open properly. And when mitral valve should be open? Anyone?
Should be open during systole.
Mitral valve should be open during diastole because during diastole, the blood flow from the left atrium to the left ventricle through mitral valve. So mitral and tricuspid valve should be open during diastole, and they should be closed during systole. So the murmur of tricuspid stenosis or mitral stenosis will be heard during diastole. Is that right?
Yes.
So aortic stenosis and pulmonary stenosis, both of them have an ejection systolic murmur, because normally during systole they should be open, and if they fail to open properly due to calcification or due to any other reason, then it will lead to an ejection systolic murmur, because the opening of the aortic or pulmonary valve become narrow and there will be no flow of blood in the systemic circulation. So what symptoms the patient can develop? A patient of aortic stenosis What symptoms can be present in a patient of aortic stenosis? The patient can develop dyspnea because the blood is not flowing into the aorta. It is accumulating in the left ventricle, and so it will accumulate in the left atrium as well. There will be no flow of blood from the left atrium to left ventricle, and accumulation of or increased hydrostatic pressure in the pulmonary vessels, so it can lead to dyspnea on activity. Also, because of a narrow aortic valve or stenosed aortic valve, there will be lesser blood in the aorta, and the coronary vessels will receive less amount of blood. So a patient with aortic stenosis can have anginal chest pain as well, and due to drop of blood pressure because of lesser amount of blood in the aorta, the patient can also have syncope or syncope attacks. Remember that aortic stenosis is the most common valve abnormality in patients who are above 65 years old. Because age-related calcifications can lead to aortic stenosis. So that's why in old age patient, if an old age patient present to you with syncope attack and there is an ejection systolic murmur in the right second intercostal space that radiates to carotid artery, then the diagnosis is aortic stenosis. So an old age patient with an ejection systolic murmur, first hint towards aortic stenosis. Remember that the murmur of aortic stenosis, the ejection systolic murmur of aortic stenosis, it radiates towards the carotid artery. And the symptoms of aortic stenosis we have already discussed, that the patient can have dyspnea, he can have inguinal chest pain, or he can have syncope attacks. Now, aortic regurgitation. Aortic regurgitation means aortic valves fail to close properly. Aortic valve uh, fail to close properly. So when should the aortic valve be closed? It should be closed during diastole. So the murmur of aortic regurgitation will be heard in diastole or early diastolic murmur. Again, in the right second intercostal space, lateral to the sternum, or right sternal border in the second intercostal space. Because the aortic valves fail to close properly, so there will be regurgitation of blood from aorta into the left ventricle. Because there is problem with the aortic valve and it is not closing properly, there will be backflow of blood from aorta into the ventricles. So that's why the patient will have symptoms of heart failure. What is heart failure? Heart failure means cardiac output is decreased or ejection fraction is decreased. Ejection fraction is decreased because of the backflow of the blood. So the patient will have symptoms of heart failure in aortic regurgitation. Now, similarly, in pulmonary stenosis, the murmur will be ejection systolic, and in pulmonary regurgitation, the murmur will be early diastolic. The difference between both of them is that the murmur of aortic stenosis, because carotid artery is a branch of aorta, so the murmur of aortic stenosis will travel to the carotid artery or radiates to the carotid artery, while the murmur of pulmonary stenosis radiates to the left shoulder of infraclavicular area. One difference is the radiation of the murmur, and the second difference is the area on which the murmur will be best heard. The murmur of aortic stenosis is best heard on the right second intercostal space, while pulmonary stenosis is heard on the left second intercostal space. So again, a short summary. Stenosis means the valve failed to open properly, and regurgitation means the valve failed to close properly. So when should the aortic and pulmonary valve should be closed? They should be closed during diastole. So that's why regurgitation murmur of aorta and pulmonary artery will be heard in diastole. And alternatively, they should be open during systole. So stenotic murmur will be heard during systole. Now let's discuss mitral stenosis, mitral regurgitation, tricuspid stenosis, and tricuspid regurgitation. It's very simple. Again, first let's discuss mitral stenosis and tricuspid stenosis. Stenosis means mitral valve and tricuspid valve fail to open properly. Both of them should be open during diastole, because during diastole the blood flows from left atrium to left ventricle through mitral valve, and from right atrium to right ventricle through tricuspid valve. So they should be open during diastole. And if they fail to open properly, then it will lead to a murmur of mitral stenosis or a tricuspid stenosis. So when they should be open in diastole. So the murmur of mitral stenosis is heard during diastole, mid to late diastole with opening click. And tricuspid stenosis is best heard also during diastole. The murmur is kind of a diastolic rumble. Where the murmur of mitral stenosis is heard, the murmur is heard at the apex of the heart, which is located in the fifth intercostal space in the midclavicular line. Similarly, tricuspid stenosis, the murmur will be heard during diastole in the fourth intercostal space over the left sternal border. Patient with mitral stenosis will have symptoms of heart failure because the valve is narrow and there is no flow of blood from left atrium to left ventricle. So there will be pooling of blood in the left atrium and in the pulmonary vessels, and the patient will have symptoms of heart failure. In tricuspid stenosis, there is no flow of blood from right atrium to right ventricle, or there is less flow of blood from right atrium to right ventricle. So there will be backflow of blood in the neck veins, such as superior vena cava, and in the peripheral veins, such as inferior vena cava. So there will be fluttering discomfort in the neck in the case of tricuspid stenosis because of the backflow of the blood. Now, mitral regurgitation and tricuspid regurgitation. Regurgitation means fail to close properly. Mitral regurgitation, when should the mitral valve be closed? The mitral valve should be closed during systole. So mitral regurgitation and tricuspid regurgitation produce a pansystolic murmur. Both of them will produce a pansystolic murmur. The pansystolic murmur of mitral regurgitation will radiates to axilla. So this is the third murmur which radiates to some other part of the body. The first one was aortic stenosis, which radiates to a branch of aorta, that is carotid artery, and the murmur of pulmonary stenosis radiates to the left shoulder, and The murmur of mitral regurgitation radiates to axilla. Mitral regurgitation and tricuspid regurgitation, both of them produce a pansystolic murmur. The murmur of mitral regurgitation radiates towards the axilla, and mitral regurgitation will produce feature of congestive heart failure and edema and ascites, etc. And in tricuspid regurgitation, if there is backflow of blood through tricuspid wall, means backflow of blood from right ventricle to right atrium, and from right atrium to peripheral veins such as inferior vena cava or superior vena cava. So in tricuspid regurgitation, there will be symptoms of right-sided heart failure. This was all about different types of murmur, how to diagnose them, and how to differentiate between them. Is it clear to everyone up to this point? Is there any question? No question? Are you guys still with me?
Sir, can you move it a little bit up? I want to see down after tricuspid regurgitation. Screen more. Yes. No, move it down. I want to take a picture of that. Yeah, that's it.
So now let's discuss some causes of different valvular diseases. Remember that the most common cause of aortic stenosis is old age. Remember that with age, calcification of heart valves can occur. Any of the heart valve can be involved. So an old age patient can have mitral stenosis, he can have aortic stenosis. Even if there is degeneration of aortic wall leaflets, he can have aortic regurgitation as well. But the most common valvular heart disease in old age is aortic stenosis. And the most common cause of mitral stenosis is rheumatic fever, and rheumatic fever. Like old age rheumatic fever can also involve any valve such as tricuspid, mitral, aortic valve, any valve can be involved in rheumatic fever as well. But the most common cause or the most commonly valve that is involved is mitral valve.
So why is aortic stenosis common in old age, not the other valves? They are not involved.
There are two reasons. One is that at the aortic area, the pressure is very high. Aortic area or aortic valve need to face a high pressure. That's why with time, it leads to calcification, which result in the narrowing of the valve, or the valve fail to open properly due to calcification of the valve. That's why that may be one of the reason that the aortic valve is most commonly affected due to old age.
Okay, thank you.
So an elderly patient with a history of stroke presents with exertional dyspnea. ECG shows atrial fibrillation and chest X-ray shows straight left heart border. Remember that this point is very important to remember that. I'll show you an X-ray. This is an X-ray of a patient with mitral stenosis. Can you see this left heart border? This is straight. A straight left heart border on chest X-ray means left atrial enlargement or left atrial hypertrophy, which can be due to mitral stenosis. Because in mitral stenosis, the mitral valve failed to open properly during diastole. That's why there's decreased flow of blood from left atrium to left ventricle, as there are increased amount of blood in the left atrium, so it leads to increase in the size of the left atrium or left atrial hypertrophy. Due to left atrial enlargement, the left heart border becomes straight on X-ray. So if in the Plab 1 exam, someone present to you with dyspnea and his chest X-ray shows straight left heart border, then you will suspect mitral stenosis. So the X-ray finding of mitral stenosis is straight left heart border. And due to mitral stenosis, there is an increase in the size of left atrium. So whenever uh, the size of the left atrium or the right atrium increases, and there is a risk of developing atrial fibrillation. So the ECG findings of mitral stenosis can be atrial fibrillation. X-ray finding is straight left heart border due to left atrial enlargement, and whenever there is an increase in the size of the atrium, the patient is at a risk of developing atrial fibrillation. So ECG can show atrial fibrillation, and we can confirm our diagnosis on echocardiogram. So the most common cause of mitral stenosis is rheumatic fever and rheumatic fever. Now, can any one of you tell me uh, the cause of mitral regurgitation? One cause is rheumatic fever. Rheumatic fever can cause mitral stenosis as well as mitral regurgitation. Can any one of you tell me any other cause of mitral regurgitation? We discussed cause of mitral regurgitation in yesterday's lecture. So if someone can remember, anyone? Can someone remember that after an MI, a rupture of papillary muscles can occur, which can lead to mitral regurgitation?
Yes, sir. Yes, sir.
Yes.
So mitral regurgitation it can be caused by rheumatic fever, and it can be caused by as a complication of MI due to rupture of papillary muscles, which usually occur 1 week after MI. So the most common cause of mitral stenosis is rheumatic fever, and we have discussed some complication of mitral stenosis, that mitral stenosis can lead to left atrial hypertrophy, which will cause a straight left border, straight left heart border, and The patient can have symptoms of left-sided heart failure and eventually right-sided heart failure as well because of backflow of blood in the pulmonary vessels, which will result in pulmonary edema and increase in the pulmonary blood pressure. So when there is increase in the pulmonary blood pressure, right ventricle will fail to pump the blood into the lungs. So right-sided heart failure will also develop in a patient with mitral stenosis.
So, in complication of MI, when there's rupture of papillary muscles, will there be mitral stenosis or mitral regurgitation?
Mitral regurgitation, because the rupture will lead to, you can say, the opening. If there is a rupture of the papillary muscle, and the wall will fail to close properly.
Right.
So mitral regurgitation will occur post MI. What will be the features of mitral regurgitation? Which kind of murmur will be heard in mitral regurgitation? Can anyone tell me?
Sorry, what's that?
Which type of murmur will be heard in mitral regurgitation?
Mid diastolic?
Systolic murmur.
Why pansystolic murmur?
It will be
Regurgitation means
failure to close.
failure to close. So when should mitral wall should be closed?
And diastole.
Systole.
In systole, mitral
Systole.
wall should be closed. So a pansystolic murmur will be heard in mitral regurgitation.